Hello everyone. Today we'll be discussing about urinary tract infection. This is an infection of any part of the entire urinary tract system, and depending upon which part is infected, there are various terms given to it. For example, cystitis, urethritis, or pyelonephritis. So for convenience, the entire urinary tract is divided into two parts, the upper part and the lower part. The upper part consists of the kidneys and the ureters, and the lower part consists of the urinary bladder and the urethra. Now, depending upon which part is infected, there are different set of symptoms. For example, if the upper urinary tract is infected, if there's an infection of that area, so a person experiences pain in the back, pain in the sides, there will be fever, nausea and vomiting. Whereas if a person suffers from infection of the lower urinary tract, there are symptoms such as burning in urine, pain during urination, there's a constant desire to pass urine but they don't pass urine or they pass a very little quantity. There will be change in the color and the odor of urine. They can have bloody urine or cloudy urine, and they will have a foul smell of urine. Along with this, they will also experience pain in the pelvic region. Now, women tend to suffer more commonly for urinary tract infection as compared to men. There are two reasons for this. The first reason is that because women have a longer urethra, which means the time taken for the urine to travel and to take an exit from the body is more in women, which makes them more prone for infections. And the second is because the urethra is in close proximity to the rectum and to the vagina. So if there's any bacteria down there, that can also add on to urinary tract infection. It is estimated that in a lifetime of a woman, about 40% there are chances of her to suffer from urinary tract infection as compared to men, which is only 10%. And also women have got a higher risk of UTI during pregnancy. When a woman gets UTI during pregnancy, she is also more prone for high blood pressure and preeclampsia. So if you suffer from any of these symptoms, do not ignore them and visit your doctor. If you get once in a lifetime or very rarely, it's fine. But if you get recurrent such episodes, we need to find the underlying cause for it, which may be diabetes or some other diseases. There are simple tips which can help you to avoid a urinary tract infection, and that is to have adequate amount of water, which is about 8 to 10 glasses a day, wearing loose cotton innerwears which helps to facilitate ventilation down there, and you should also not hold the urge to pass urine. Whenever you get an urge to pass urine, you must pass urine and not ignore that urge. You should not have alcohol and coffee because they act as an irritant and can cause infection. And after indulging in a sexual activity, you must empty the bladder, which will prevent the entry of organisms. After every time you urinate or you pass motions, you must clean the lower part in the direction of front to back. So these are certain simple tips which will help you to avoid getting this infection. And even if you get this infection, homeopathy has got a very good role to play, whether you have got it for the first time or whether you are getting it many times. That is, if it is a recurrent UTI. So treatment depends upon the cause of UTI, and accordingly the medicine is given. So choose homeopathy if you suffer from UTI. Thank you.